Hello, I'm Dr. Doris Rapp, and I want to talk to you today about something that really has me upset. Today we are treating children that have ADHD and bipolar illness with off-label drugs. What does that mean? It means that these drugs have not been checked for safety in children. And what is happening? There are reports of 5-year-olds having heart attacks and strokes and dying. There are reports of 3-year-olds. There was one recently on television, and the 3-year-old was on 3 or 4 different off-label drugs, and the child died after 6 months. The child had supposedly had chronic liver and heart disease, and the parents were charged with murder and put in jail. This is terribly wrong. Let me tell you what we can do about it. Many youngsters are hyperactive, out of control. The parents don't know what to do. They're desperate. They go to the doctor, and the doctor has to say, well, all I've got are these drugs to give your child. Well, I can tell you there are other ways that are easier, faster, a lot safer, and better. And I want to share with you some videos, a few of many that have been taken over the many years that I was in practice, to show you exactly how dust, mold, pollen, foods, and chemicals can affect how some children act, behave, learn, write, draw, you name it. Any area of the body can be affected. I think you'll be astounded by what you're going to see. And this is one reason why, when some of these were shown on television, we received thousands of letters, many of them tear-stained, from parents who said, why didn't somebody tell me that it could be an allergy causing my child to misbehave? If you don't want to put your child on drugs or keep your child on drugs, you might find that these videos will demonstrate exactly how your children act. And because of that, you'll be able to figure out why your child is misbehaving, and no one understands why.
Is this about as quiet as he gets?
Yep.
This is about it, okay?
This is it. Yep.
Oh, I was going to say that one time, though, when we were on an elimination fight, I tried to kill Mom with a wood poker.
And he tried to stab me. Some of those reactions were instantaneous.
Okay. Now, you thought that this would cause trouble. You don't have to, you can bite several bites, honey. You don't have to eat it all at once.
You want us to eat both?
We could have skin tested him for tomato, but I thought it would be better if you saw him eat a tomato.
Side.
You're fine.
How do you feel, Ned?
Angry.
Have you felt this way before?
Very nice.
Oh, you were so
Very
good.
nice.
Ned, how are you feeling now?
Okay.
Quite often, children will say they're too hot and they want to take off their clothes when they're reacting.
I did want to die a long time ago because I didn't know what was wrong with me, and I thought I'd be better off dead. But now that I know I'm going to get fixed and everything, I want to live and have a life.
Hey, glad you're here.
Okay.
Feeling better?
Yeah, I'm doing all I can to be here. The perfume is and everything, and the odors in this place are so bad.
Notice the allergic eye shiners, the dark circles under his eyes.
Does anything bother you at all?
Nope.
Does your head hurt?
A little bit.
A little bit? Where does it hurt? Can you point to where it hurts, Michael? Right on that side? Okay. Does your tummy hurt today?
No.
No? Okay.
It's hard for parents to hold children, and when they react like this, sometimes they're dropped, and then the parents are accused of battering. One drop of the right dilution of sugar and he's back to normal.
You just look right straight at me, Jeff. Okay. You say,
No, don't hit your mother.
no. Do it again.
John was so violent at home, and he was always biting his mother's arms, and the result was that his mother had black and blue bite marks up and down her arms at all times when she came to the office initially. And then later on, she was surprised and pleased to find that he was no longer biting and she didn't have those marks.
Come on now. That's no way to do.
There's his demonic look, and he usually becomes quite wild. The parents call it a demonic look. They all use the same word.
When you see a child sitting there normal 1 minute and then like that the next, you know it's not bad behavior.
Many of these parents have been told that they are bad. They've been told that their children are bad, dumb, and lazy. And they will find out that it's a misdiagnosis. There's nothing wrong with the parents or their parenting skills. There's nothing wrong with the child. The child simply has been eating the wrong foods or smelling or inhaling dust, mold, pollen, or chemicals that are affecting the brain. In other words, many allergies cause hay fever, asthma, itchy skin, but some of these allergenic substances affect the brain, how you think, how you act, how you behave, the muscles, the joints, your bladder. Any area of your body can be affected. There's a 1-week allergy diet that excludes highly allergenic foods. Many of you have already been on the diet, or many of you have purchased my book and tried the diet on your own, and you know how effective it is. You know that within 3 to 7 days, when you stop eating the foods that are causing problems, your child is dramatically better, not a little, dramatically better. And then during the second week, when you add the foods back one at a time, milk on one day, wheat on another day, eggs on another day, by the end of the second week, you know exactly which food causes which problem, which foods cause a child to get hyperactive, which foods cause a child to get aggressive, which foods cause a child to be unable to think or write clearly, which foods cause bedwetting, muscle aches, joint pains, headaches, you name it. You have many answers. And if the whole family is put on this diet, the other family members who have food sensitivities will quickly know which foods cause them to have symptoms. Now, what else can we do that's fast, easy, and inexpensive? And the answer is you can get an air purifier. Air purifiers take out dust, mold, pollen, and some chemicals. These are the other things that cause most allergies. So if you combine the diet with the air purifier, you can improve children as much as 70, 80, 90, even 100% in 1 to 2 weeks. What could be better than that? Is there any downside? None that I can think of. You just make sure that the parents don't give their children any foods that they know make them sick, and that's just common sense. Many parents have simply read one of my books, such as the one, The Impossible Child at School and at Home, tried the diet, put in the air purifier, and all on their own, without seeing anybody, figured out why their child can't learn and behave and act appropriately.